Hey y'all, it's me, Dr. Samina Rahman, Gyno Girl. I am going to talk today a little bit more about these vulvar skin conditions. Oh my God, I'm seeing so much of it in my office these days, and I'm hearing some of the comments that you want more information and more concise and more succinct. And we're going to do that. I'm going to tell you about a couple cases I saw in the last week of Lichen planus. So we're going to get a little more details succinctly about Lichen planus so you guys can get a little more information to take back to your clinician. So let's get at it. I wanted to do a video a little concise, a little to the point, and a little more information about some of the vulvar dermatoses that I've discussed in other videos. You can see here and here, we did a discussion of an overview about vulvar itching, and then the other one about specifically the 3 types of lichen diseases that I see in my office: lichen planus, lichen sclerosus, lichen simplex chronicus. But today I want to go a little bit deeper for you guys, Lichen planus. I've read some comments and I'm trying to be a little more succinct and a little more to the point so that you guys can get some information that you might be able to utilize. None of what I give you should be medical advice for you specifically, but maybe it'll give you some insight into someone you know or some disease process that you're dealing with. I'm a board certified gynecologist. I have a specialty in menopause, sexual medicine, vulvar dermatoses, pelvic pain. I have my own private practice in downtown Chicago, and please like and subscribe to my channel. Okay, so this week I saw a couple of new vulvar dermatosis conditions, and I want to dive into the Lichen planus, 1 or 2 cases that I saw in the past week. And remember, like all the lichenoid skin conditions that we talk about are inflammatory skin diseases of the vulva. And so we talked about lichen sclerosus, we talked about lichen simplex chronicus, which is really vulvar eczema, usually from a contact dermatitis. This time I want to talk about Lichen planus, specifically erosive Lichen planus. Let me give you guys a sample of a patient that I saw recently. This is what her vulva looked like. She's around 60 years old, and she was diagnosed with lichen sclerosus at an outside office and had been dealing with it off and on for about 10 years. Seemed to be well controlled. All of a sudden, out of nowhere, she's gotten a flare-up of her vulvovaginal condition. The vulva looked angry like this. She's having painful sex. She's uncomfortable. She really can't even sit. She's on a potent steroid, clobetasol, that is standard of care for lichen sclerosus. And she had been doing well, and all of a sudden this came up. Another interesting thing she told me was that she had previously loved to eat chips and was doing well with that for a very long time. But unfortunately, she developed some sores in her mouth and some lesions, and she couldn't really eat the salty chips anymore because it was so uncomfortable. She also has started noticing some like itchy scalp. I know you guys say I touch my hair too much, but it was kind of like she was, even in the office. Really nothing else body-wise, but she does have other autoimmune conditions. Hashimoto's, and which is a thyroiditis condition related to your thyroid disease, autoantibodies to thyroid disease. Again, this is what the vulva looked like. I did a biopsy, a couple of biopsies. It did come back erosive Lichen planus. Okay, so it's erosive vulvar vaginal Lichen planus. And so I know a lot of you may think about the video that I did on Lichen planus and how corticosteroids, specifically clobetasol, should be first line. But really there is, after doing research, there is really no first line for Lichen planus. We don't have enough studies on Lichen planus in general, but just from expert opinion, ultra potent topical steroids should be first line, and that's your clobetasol. And she was on that for lichen sclerosus, so here she is having this eruption. So what's going on here? Really, for lichen planus, there's really no standardized first line therapy. We try this corticosteroids, and for a lot of patients it helps. But if you look at some of the studies, about up to 40% of women actually fail to respond to this first line of topical ultra potent steroids. It's anywhere from 20 to 40% depending on what you are seeing, study you're reading. And so then I had to start thinking, like, what else is going on with this patient? It looked like lichen planus, it looked angry, she's on the corticosteroids. What else can we do? Well, she's postmenopausal, right? So we have to address the genitourinary syndrome menopause and how that might be contributing to some of the sexual pain and the tissue integrity. I did discuss with her about going on vaginal estrogen to help perhaps mitigate some of the symptoms she was having and to treat that and maybe overall help her lichen planus. The thing about lichen planus that's different from lichen sclerosus and lichen simplex chronicus is that unlike those other pro-inflammatory skin conditions, which we think have an autoimmune component, this condition may involve the vagina. So the vagina has to be addressed. And so she had not been having vaginal dilators, she had not been in pelvic floor therapy. And so that was something that was going to be part of her therapy as well, right? Because the vagina can be affected by lichen planus. And she had erosive lichen planus. Also, she had additionally other lesions, right? She couldn't eat chips anymore all of a sudden. So the oral lesions were there. The oral lichen planus was visible. I'm not a dermatologist, so I don't really evaluate scalps like that. But after I sent her to my derm friend, she did turn out to have lichen planopilaris of the scalp, which was potentially even severe form. So just remember, lichen planus can be outside of the vulva. And also there was a study that showed up to 68% of patients with lichen planus have multiple site disease. So not just the anogenital area. And that's really important to know. It can be in the esophagus, it can be in the anus, it can be in the scalp, it can be in other cutaneous areas. So we have to remember that. So here she is, very uncomfortable, can barely sit, biopsy proven lichen planus, no evidence of cancer. And so how do we treat this? Unfortunately, a lot of patients with lichen planus don't have a lot of time periods where they're in total disease remission. And there's no FDA approved product specifically for vulvar lichen planus or lichen planus systemically. So we have to look at all the things that we have available, and we have to work with our derm colleagues on some of this, and I'll talk to you about that. Okay, so she's tried the ultra potent steroid, that's clobetasol or halbendazole. Those things are not working for her. And sometimes they don't, as I told you before. So then I was like, we could try something called the calcineurin inhibitor, which is tacrolimus, pimecrolimus. Also, because of the potential vaginal involvement, we have to address the vagina, right? So what do we do for that? We will give her vaginal dilators to utilize. She is seeing my pelvic floor physical therapist. She will get some intravaginal hydrocortisone suppositories and use those nightly. So those are intravaginal suppositories of hydrocortisone, reduce the inflammation. And then sometimes we'll do intralesional injections of steroids. So that's your triamcinolone. We take the steroid, we inject it directly into areas that are bothersome. If patients have adhesions around the vulva that's preventing intercourse, we will lyse those adhesions and interrupt that so that we can get a better response to therapy. And again, pelvic floor physical therapy is paramount. Now, with her as well, I gave her systemic steroids so that we could calm down this acute phase reaction that she might be having with potentially worsening conditions. So we did use steroid taper that would hopefully help her symptoms and help her be able to tolerate sitting and being less uncomfortable on a day-to-day basis. Because you can see it looks like a very angry vulva and vagina. And so, that's kind of the start. But what are some of the new therapies coming out for lichen planus, or what are some of the new treatment options? A lot of times I'll have to work with dermatologists because there are some systemic therapies that are utilized for vulvovaginal lichen planus. Remember, it's a pro-inflammatory skin condition and believed to be, autoimmune in nature. So that's your own body using your own, inflammatory markers, whether or not it's cytokines or the white blood cells. They're marching up, trying to attack your own body, right? So some protein in your own situation. So there's an inflammatory response happening and we have to control it. And that's why steroids are often used, because they're anti-inflammatory. Some patients have done well with hydrochloroquine, methotrexate. Some patients need antibiotics and they need to treat any superimposed infections, whether or not it's staph or yeast. And then cyclosporin and some other what we call biologics. Biologics are going to play a big role in vulvar lichen planus, And so for really patients that are having real difficulty, we turn to our derm colleagues, and they are using a lot of what is called Janus kinase inhibitors. These and they're called JAK inhibitors, okay? So that's for oral, esophageal, cutaneous, scalp, other types of Lichen planus. What makes JAK inhibitors really unique is that they interfere with your body's signal that is thought to be related to inflammation, like interferes with the signaling of your cytokines, and this ultimately will reduce inflammation. So things like eczema, psoriatic arthritis, vitiligo, these medications are being used in this, but also some experimentally with Lichen planus, and some studies showing some relief, particularly of extragenital regions. When you have less inflammation, your whole system will calm down, and then it can be very helpful for your symptomatology. Some of the JAK inhibitors are listed here, okay? And so I do not personally prescribe them. You have to really be careful the side effects, because they're commonly seen side effects. You can get headaches, nausea, you can get urinary tract infections, bronchitis, common cold infections, because you're really trying to tone down your inflammatory system and your immune system. And so, every medication affects people differently. We look at all your comorbidities, and most of my derm colleagues will then start to manage these patients pretty effectively if especially for the patients that are not responding to the topical agents, the intralesional medication that I've given, or any other type of therapy, whether or not it's lysis of adhesions or pelvic floor therapy, or really treating the vagina as well. So specifically, like in the case that I was describing, this patient did go to her dermatologist, and I do believe she got placed on one of the JAK inhibitors, these Janus kinase inhibitors, which are really up and coming for Lichen planus, particularly when it's extragenital as well. And so, we do our best to try to treat these patients to the best of our capacity. I did give her the diagnosis, and she was able to see one of my derm colleagues. So hopefully she will get some systemic relief very soon. But the key points that I want you to remember about Lichen planus is that it is an inflammatory skin condition of the vulva. It can cause vulva and vaginal issues. There is potential, vaginal stenosis that can occur if the vagina is not treated. So that's when we use those suppositories in the vagina, the hydrocortisone, the vaginal dilators, pelvic floor physical therapy. So a lot of the patients may present with sexual pain and redness down there, and that's how I come to see these patients. And then we look for any other sources of extragenital Lichen planus. We try the ultra-potent steroids, we try the calcineurin inhibitors, we try everything that we can. Intralesional, we might give systemic steroids like prednisone with a taper. And then really, because of the extra lesions in her scalp as well as other places in her mouth and her skin, she is getting treated with some of these biologics from her dermatologist. So that is a little bit of a tidbit about Lichen planus specifically. I just wanted to introduce this and reintroduce this for those of you who had some concerns about understanding what's happening. Again, this is not meant to be your medical advice, but maybe will give you a little more education so you can advocate for yourself when you see someone for this condition. You can go to www.issvd.org, which is the International Society for the Study of Vulvovaginal Diseases. You can go to www.ishwish.org. That's the International Study of Women's Sexual Health, and hopefully find someone that can help you navigate your journey. So until next time, I hope this was beneficial to you, and please, comment. I don't always comment back, but I do read your comments, and I hope that you're able to find the help that you need for this very difficult condition. That's it, guys. Sorry, my kids are at home today in case you hear them in the background. That is it for today. More later. Please like and subscribe to my channel. Please let me know if there are other things that you're interested in learning about, and we'll see you next time. Thanks again.